Welcome back, everyone. You are enjoying another episode of Fast Facts Pharmacology Edition, brought to you by a Tale 2 hygienist in partnership with Elevate Oral Care. And now, please welcome your host, Tom Viola.
Hi, I'm Tom Viola, a certified pharmacist, dental educator, and author. Stick with me, and I promise to make the next few minutes the best pharmacology learning experience you've ever had. Hi everybody, Tom Viola with Pharmacology Declassified with yet another Fast Facts Pharmacology Edition. Well, we're continuing in our discussion of opioids and opioid analgesics in dentistry and the pharmacology of opioids specifically. But before we even get to what opioids do, let's talk about what types of opioids there are. And we know that in the practice of dentistry, we use three specific opioid analgesics. We use opioid analgesics that combine codeine with acetaminophen, and the most famous name brand for that would be Tylenol with codeine. We use opioids like hydrocodone when combined with acetaminophen. That would be brand names like Vicodin and Lortab and Norco. And then we sometimes use oxycodone in combination with acetaminophen, and that would be brand names like Percocet or Endocet. So there's quite a few different types, but they all basically focus on those three different opioids in combination with acetaminophen. Now, many people will tell you that codeine really doesn't have any activity on its own. Codeine is essentially a prodrug, which means your liver has to metabolize it into something else for it to have an effect. Otherwise, basically, all you'll get from codeine is constipation. Well, okay, what is it metabolized into? Morphine. But you have to have enough of the enzyme to get that done, and many people don't, or aren't very good metabolizers of codeine, so they don't get the full benefit. Then again, there is such a thing as placebo effect, right? Hydrocodone and oxycodone on their own are not prodrugs, they are active drugs, and so they are metabolized rather quickly by the liver, and they are very effective in managing pain, especially in combination with acetaminophen. And that's my question. Why the acetaminophen? Why the combination? Why do we have to have an opioid plus a non-opioid? Well, again, it's all about that synergy, right? We know that if we can combine an opioid with a non-opioid in the right combination, we're going to be able to use less of the opioid and less of the non-opioid and still get a greater overall effect. And that is the magic behind synergy, okay? It's being able to combine ingredients to get that greater overall effect while using lower doses and therefore causing less toxicity. Okay, but having said all that, how do they actually do what they do? Well, opioids work on separate receptors in the brain. They basically inhibit substance P, which is a neurotransmitter that allows the transmission of pain from the periphery to the brain. Okay, so if substance P is the neurotransmitter that allows pain to go from peripheral nerves to central nerves, or from outside the brain to inside the brain, well, opioids inhibit substance P. But they work at different receptors like mu, delta, kappa, so they can have analgesic properties. But because they work at those other receptors, they also have various other side effects like meiosis and constipation, and even sometimes dysphoria. So opioids are complex and not very easy as far as understanding their pharmacology, but the simpler the better, as far as I always say. Let's focus on opioids and the fact that they can blunt transmission of pain, and therefore they're necessary tools in the arsenal we have to treat odontogenic pain, especially significant odontogenic pain. More on that in our next episode of Fast Facts Pharmacology. Until then, my friends, this is Tom Viola saying, have a good day every day, and be well. Oh, and one more thing. If you want to hear more from me, be sure to follow me on Instagram, Facebook, or visit my website at www.tomviola.com.
Thank you for listening to another episode of Fast Facts Pharmacology Edition, brought to you in part by Elevate Oral Care, creators of the innovative and proven prevention-focused oral care products from Advantage Arrest Silver Diamine Fluoride to Fluoramax Sodium Fluoride Varnish. Learn more by visiting www.elevateoralcare.com and schedule your free CE staff meeting today. We'll see you next time for another Fast Fact.